As we journey through the golden chapters of life, certain routines that once felt ordinary begin to change meaning. Bathing, for instance, is something most of us have done daily for decades without much thought. A refreshing shower before work, a warm bath after a long day. These habits became comforting rituals that helped us feel clean, awake, and renewed. But as the body ages, the needs of our skin, muscles, and overall well-being shift in gentle yet significant ways. What once kept us feeling vibrant may now quietly work against us. And so a simple question arises, one that many seniors, caregivers, and family members often wonder but rarely ask out loud. How often should older adults bathe? It may sound like a small matter, but the answer can make a profound difference in health, comfort, and quality of life. Doctors and geriatric specialists emphasize that bathing, while essential, must be approached differently in our later years. The skin, our body's largest organ, undergoes tremendous transformation with age. It becomes thinner, more fragile, and less capable of retaining moisture. The natural oils that once protected it from dryness and irritation diminish over time, leaving it more sensitive to soaps, hot water, and friction. For this reason, dermatologists now advise that many older adults should bathe only 2 to 3 times per week. This recommendation might surprise those who equate daily bathing with hygiene, but it reflects a deep understanding of how the aging body functions. Too frequent washing can strip away vital oils, leading to dry, itchy, and even cracked skin that can invite infection. Conversely, too infrequent bathing can allow bacteria to build up and cause odor or discomfort. The key lies in balance, maintaining cleanliness while preserving the skin's natural barrier. When doctors suggest bathing less often, they are not suggesting neglect. In fact, this advice stems from compassion, caution, and respect for the body's natural rhythms. Senior skin often produces less sebum, the oil that keeps it supple, which means daily soap and hot water can lead to micro tears or rashes. A gentle schedule of bathing 2 or 3 times a week allows the skin to stay clean without constant irritation. On non-bathing days, simple sponge baths or towel baths can help maintain freshness, using a soft, damp cloth to gently clean the face. Underarms, groin, and feet can be enough to feel refreshed and confident. This method, paired with breathable clothing and light moisturizers, helps the body stay clean and comfortable while avoiding overexposure to water or soap. Bathing also involves much more than cleanliness. It's a physical act that requires balance, strength, and coordination. Things that naturally become more challenging with age. The bathroom can be one of the most dangerous places for older adults, with slippery tiles, shifting mats, and unpredictable water temperatures posing serious risks. Doctors often remind families that safety should always come before routine. Installing grab bars, using non-slip mats, or having a shower chair can make a world of difference. Even adjusting bathing time to morning hours, when energy levels are higher, can help prevent dizziness or fatigue. In this way, bathing becomes not only a moment of hygiene but also one of mindfulness. an act of self-care that respects the body's limits and honors its needs. But why exactly is less bathing better for older adults? The science lies beneath the skin. When we bathe, especially with hot water, we wash away sebum, the waxy oil produced by sebaceous glands. For younger people, these glands replenish oil quickly. In older adults, however, this process slows down dramatically. Once the protective oils are gone, water evaporates faster from the skin's surface, causing dehydration and tightness. Over time, this can lead to what doctors call xerosis, the medical term for dry, cracked or flaky skin. In extreme cases, itching becomes so persistent that scratching leads to open sores, which can easily become infected. Bathing too often accelerates this process. That's why dermatologists suggest using lukewarm water rather than hot, and choosing mild, fragrance-free cleansers instead of harsh soaps. After bathing, gently patting the skin dry and applying a good moisturizer, while the skin is still slightly damp, helps seal in moisture and restore the natural barrier. There's also an emotional side to bathing that cannot be ignored. For many older adults, bathing is deeply connected to dignity, independence, and personal comfort. It's more than a routine. It's a symbol of self-sufficiency. Yet for some seniors, fear of falling, cold temperatures, or physical pain can make bathing stressful. That's why caregivers and family members should approach the topic with empathy, encouraging a flexible schedule rather than insisting on daily baths can reduce anxiety and help seniors maintain a sense of control. Some find comfort in setting a consistent routine, perhaps bathing every Monday, Wednesday, and Saturday, and while others prefer to bathe when they feel they need it. The goal is not perfection, but peace and safety. It's also worth noting that the concept of cleanliness has evolved. Centuries ago, daily bathing was rare and unnecessary. People relied on natural fabrics, airing out clothes, and gentle wiping to stay fresh. In modern culture, advertising and social expectations made daily showers seem like a moral duty. But in truth, cleanliness is about health, not habit. The human body doesn't accumulate harmful bacteria overnight. Most of what we remove during a shower is sweat and dead skin cells. For older adults with limited mobility or fragile health, a moderate bathing schedule is not only acceptable, it's medically ideal. The focus should shift from how often we bathe to how well we care for our skin and comfort. The type of bathing matters too. A quick shower might work well for some, while others prefer the calm of a warm bath. However, doctors advise avoiding very hot baths or sitting in water too long, as this can lower blood pressure or cause dizziness upon standing. For those with dry or itchy skin, adding a few drops of olive oil or oatmeal bath products can soothe irritation. After bathing, it's best to apply a gentle moisturizer immediately, particularly on the legs, arms, and back, where dryness is most common. Cotton towels and soft bathrobes are better than rough fabrics, which can irritate the skin further. Every detail, from temperature to towel texture, contributes to overall well-being. For older adults dealing with chronic illnesses like diabetes or arthritis, bathing habits may need further adjustment. Diabetic skin, for instance, tends to be more prone to dryness and infection, so extra care must be taken to avoid small cuts or cracks. Seniors with arthritis might find it painful to bend or reach, so handheld shower heads or bath wands can make cleaning easier and safer. In all cases, the advice remains the same: gentle care, mindful frequency, and the right environment make all the difference. There is also a powerful psychological component. The ritual of bathing can be deeply calming, a chance to slow down, reflect, and feel refreshed. But when the act becomes difficult, it can also create frustration or embarrassment. That's where caregivers play a key role. Helping a loved one bathe should be done with patience, privacy, and respect. Warm towels, soft lighting, and soothing conversation can turn the experience into something peaceful rather than clinical. In many assisted living facilities, caregivers are trained to make bathing time feel personal, not rushed or routine, but nurturing. For those living independently, setting up a safe and pleasant environment can do the same. A warm room, stable water temperature, and easy-to-reach supplies create an atmosphere of confidence and comfort. When we step back and consider all these factors, it becomes clear that bathing for seniors is about quality, not quantity. Doctors aren't prescribing fewer baths to limit hygiene, but to promote healthier, happier skin and safer routines. The key principles are simple. Bathe 2 to 3 times per week. Use lukewarm water, mild soap, and apply moisturizer immediately afterward. On other days, targeted cleaning with a damp towel and good hygiene habits are perfectly adequate. Changing undergarments daily, keeping bed linens fresh, and staying hydrated all contribute to overall cleanliness and well-being. Remember, the body cleanses itself in many ways. Through the liver, kidneys, and natural sweating. Bathing simply assists in that process. It doesn't define it. In the grander sense, this question, how often should seniors bathe, reflects a larger truth about aging itself. The older we grow, the more we must listen to our bodies rather than to social expectations. What feels good, what keeps us safe, and what brings peace. These are the real markers of wellness. If bathing every other day feels right, that's fine. If twice a week feels best, that's fine too. The important thing is to respect your body's cues. Dry, flaky skin might be asking for fewer baths and more moisture. A sense of fatigue or dizziness might be asking for morning routines or sitting showers. Each individual is unique, and so too should be their bathing rhythm. Families and caregivers should understand that changing bathing frequency is not a sign of decline or neglect. It is an intelligent adjustment, a reflection of wisdom and self-care. The goal is to preserve comfort and dignity, not to adhere to rigid schedules. When a senior maintains a clean, safe, and pleasant routine, even if it's just a few times a week, they are honoring their body in a deeply human way. And for those who might worry about body odor or hygiene between baths, simple daily practices can make a huge difference. Wearing clean, breathable clothes made from cotton or linen helps prevent sweat buildup. Using a mild deodorant, keeping nails trimmed, and brushing teeth regularly all contribute to freshness and self-confidence. Many seniors find that gentle, cleansing wipes or soft wet towels work perfectly for touch-ups. These little acts of care can help maintain a sense of cleanliness and dignity even on non-bathing days. Another subtle but important part of this conversation is hydration. The condition of our skin is often a mirror of what's happening inside the body. Drinking enough water, eating fruits rich in antioxidants, and maintaining balanced nutrition all help keep the skin supple. Bathing routines, therefore, should go hand in hand with overall health habits. A senior who stays hydrated, moisturizes regularly, and bathes moderately often has glowing, healthy skin that needs very little external interference. Ultimately, the best bathing schedule is the one that fits comfortably into a senior's life, minimizes risk, and enhances well-being. A few decades ago, no one imagined we'd be debating how often to shower. Yet today, we understand that more is not always better. The modern doctor's advice for seniors is rooted in science and compassion. Bathe enough to feel fresh, but not so much that your skin suffers. Listen to your body, adjust your habits, and remember that your comfort and safety come first. So how often should older adults bathe? Most doctors say 2 to 3 times a week is ideal. But the real answer lies in balance. Bathe when you need to, in an environment that feels safe and soothing. Use mild products, avoid harsh chemicals, and moisturize afterward. Make bathing less of a chore and more of a cherished ritual. A quiet moment of self-care that honors the journey your body has taken through all these years. Aging is not about doing less. It's about doing things differently. It's about learning what your body now needs and responding with kindness. Just as we once taught our children to care for themselves gently, we must now extend that same gentleness to ourselves. Every step, every bath, every small choice in our routine can become an act of wisdom and self-love. When viewed this way, bathing becomes far more than cleansing. It becomes a reflection of who we are, resilient, graceful, and wise. So tonight, as you prepare for your next bath, take a moment to feel gratitude for your body, for all it has carried you through. Turn down the hot water, reach for the gentle soap, and treat your skin with the respect it deserves. Whether you bathe every day, twice a week, or whenever you feel it's time, do it not out of habit but out of harmony, because caring for yourself at any age is the truest form of wisdom. For more videos, subscribe my channel.